In a world still haunted by the echoes of the COVID-19 pandemic, where the loss of millions and the global economic paralysis are fresh in collective memory, the recent agreement by the World Health Organization's member states marks a monumental turning point. After over 3 years of painstaking negotiations, international delegates have come together to form what the WHO calls a historic pact, a legally binding commitment to ensure the world never again faces a pandemic with the same level of vulnerability, disorganization, and inequality. And despite political friction and the withdrawal of the United States under President Trump, this development signals a profound recommitment by the global community to prioritize life, cooperation, and resilience above all else. The significance of this agreement cannot be overstated. It represents not only a policy document, but a transformation in mindset, one born out of the devastating lessons of the early 2020s. This pact reaffirms a simple but powerful truth, that in the face of a fast-spreading virus, no nation is truly independent. We are all interconnected, and only a coordinated, well-prepared global response can hope to minimize the damage of future outbreaks. For many countries, especially those that bore the brunt of delayed vaccine access or overwhelmed medical systems during COVID-19, this treaty is a long-awaited acknowledgement of past failures and a clear path toward collective improvement. At its core, the agreement lays down a framework that addresses some of the most critical weaknesses exposed during the last pandemic. One of the key pillars of this pact is the establishment of a global system for pathogen access and benefit sharing, a mechanism that ensures once a new threat is identified, it can be rapidly sequenced, studied, and used to produce diagnostics, vaccines, and treatments in a transparent and equitable way. This is a major step forward. During COVID-19, many lower-income countries were left behind in the global scramble for protective equipment, tests, and vaccines. By contrast, this agreement enshrines the idea that access to medical countermeasures is not a privilege for the wealthy, but a right for all. Equally important is the focus on building research capacity across multiple regions rather than concentrating it in a handful of nations. This geographic diversification of scientific infrastructure not only boosts regional preparedness, but also helps ensure that more countries can respond quickly and effectively to emerging threats. It's a shift from reactive crisis management to proactive health defense, a move that gives all nations, big and small, a stake in the front lines of protection. Another key component is the proposal for a global supply chain and logistics network. This idea may sound abstract, but its practical implications are enormous. It means that when the next pandemic hits, we won't see a repeat of the harrowing images from 2020. Empty hospital shelves, exhausted nurses reusing masks, and nations hoarding supplies. Instead, the world will have a coordinated mechanism to move essential goods where they're needed most, with less delay and less chaos. The treaty also underscores the urgent need to strengthen national health systems, particularly in areas like surveillance, emergency response, and medical staffing. Resilience is no longer a buzzword. It's a necessity. For the agreement to succeed, countries must invest in their healthcare infrastructure now, not after a crisis has already erupted. And with member states publicly committing to these upgrades, there's new momentum behind long-needed reforms in public health policy, data transparency, and cross-border cooperation. Perhaps what makes this agreement even more extraordinary is that it was reached in an era when global cooperation is often at risk. With growing nationalism, geopolitical tension, and widespread mistrust of multilateral institutions, the very idea that nearly 200 countries could agree on such a comprehensive and forward-thinking pact feels like a triumph of unity against cynicism. It is a vote of confidence in multilateralism, in the ability of the global community to transcend borders when lives are on the line. And it proves that even when powerful players like the United States step away, progress is still possible. Critics will inevitably point out that enforcement remains a challenge. A treaty, after all, is only as strong as the political will behind it. And there's no doubt that follow-through will require vigilance, funding, and ongoing cooperation. But what sets this agreement apart from so many past efforts is that it isn't just about principles, it's about operational readiness. It's a toolkit, a blueprint, and a signal of resolve. The decision to present this pact to the World Health Assembly in May underscores its democratic legitimacy. It won't be imposed from the top down. It will be debated, refined, and, hopefully, adopted through collective consensus. That process alone reinforces the Pact's most important message, that the future of global health must be inclusive, transparent, and anchored in solidarity. In many ways, this moment represents a redefinition of what global health cooperation can look like. It is a moment of hope, a belief that even amid fractured politics, humanity can come together to defend itself not with walls, but with shared purpose. The COVID-19 pandemic shattered the illusion of invincibility that many developed countries clung to. This agreement is the sober, constructive response to that realization. It is the world saying, "We remember, we've learned, and we are ready." Whether it is Ebola, SARS, COVID-19, or the next unknown threat lurking on the horizon, this agreement makes one thing clear. Next time, we will not be caught off guard. Next time, the world will stand stronger, together.